In this lecture, we are going to discuss the different aspects of the hepatitis A virus that actually cause the hepatitis. So let's get started. First of all, we will look at the different properties of the hepatitis A virus. So hepatitis A virus, also known as the enterovirus. Why do we call it entero? Because it actually replicates in the GI tract, and after that, it will affect the liver. So that's why we called it enterovirus, or you can say enterovirus 72. Okay. So what family does it belong? So it actually belong to the picornavirus family. Okay, that's the most important thing. Picornavirus virus family. Okay. So if we discuss the shape of the hepatitis A virus, so hepatitis A virus is actually icosahedral in shape. Okay. So it is actually icosahedral, means 20-sided nucleocapsid. Basically, virus has two things major. Outermost is the capsid, C for capsid, and inside, specifically in the hepatitis A virus, you will see the presence of single-stranded RNA, ssRNA, and it is actually present in positive polarity form. So positive mean it is actually just similar to the messenger RNA. So it is actually single-stranded RNA genome. Okay. And outside you will see the capsid, and that is icosahedral, mean 20-sided in shape. And there is no envelope present outside the hepatitis A virus. Okay. So if we discuss the serotype, so hepatitis A virus has only one serotype. In this case, you will see the only one serotype of the hepatitis A virus. So if we look at the transmission, how does this virus actually transmit to our body? So it actually enter through the oral route and exit through the fecal route. So it actually enter through the oral route. Okay. And it will enter into the GI tract, and after passing through the GI tract, stomach and the small intestine, it will pass through the fecal route. So we called the route of the hepatitis A virus is actually orophycal. So actually, when the food contaminated or the water contaminated with the feces, and if the person drink that contaminated water, then that can be affected by the hepatitis A virus. So it means that fecal contaminated food or water enter into the body of the person, and that person will be affected by the hepatitis A. So it is actually a cycle between the oral and the fecal route. So that's why we called it orophycal transmission. That's the most important thing. And mostly the children actually affected by the hepatitis A virus. Children affected by hepatitis A virus. Okay. So if we look at the epidemiology, so in epidemiology, you will see uh, what type of the persons actually affected by the hepatitis A virus. So summer camps, persons, homeless persons, and the boarding schools persons or the students are mostly affected by the hepatitis A virus. Okay, and next, food or the water, contaminated food or the water with the feces of the hepatitis A virus persons. So that's the most important thing. Contaminated food and the water. An important thing which you have to remember, that the hepatitis A virus start secreting into the feces of the patient before the symptoms of the hepatitis A virus, 2 weeks before the symptoms of the hepatitis A virus. Okay. And next, if we look at the pathogenesis. So as we know that the hepatitis A virus enter through the mouth. Okay. So if you see, this is a hepatitis A virus. Okay, it will enter into our GI tract. It will move into the stomach, and after that, it will enter into the intestine. Okay. From the intestine, it will enter into the portal vein. Okay, portal vein. That vein is actually entered into the liver. So now, from the GI tract, hepatitis A virus from the portal vein enter into the liver. Okay. So if I say that here is the cell of the liver, means hepatocytes. Hepatocytes. Okay. When that virus infect the cells, or you can say hepatocytes, then after that, that cell of the liver, hepatocyte, will be detected by the immunity. And the cytotoxic cells, here are basically the cytotoxic cell detect the infected hepatocytes and attack these hepatocytes and destroy the whole hepatocytes. Now here is the destruction of the hepatocyte. So it means that our immune system destroy the infected hepatocyte. That's the most important thing. This is the, and ultimately you will see the hepatitis in this case. An important thing which you have to remember, that the after the recovery, so actually the recovery time of the hepatitis A virus is actually the 2 to 4 week are the recovery time of the hepatitis A virus. So after that, the damaged liver will start repairing and there is no chronic form present in that case. Okay, that's the most important thing. Next, if you look at the replication, so as we know that the hepatitis A is actually a single stranded RNA. So genome is actually the single stranded RNA, and it is actually present in the positive polarity form. So first of all, so as we know that the positive polarity RNA will act as messenger RNA. It will result in the formations of the polypeptide, and after that the polypeptide cleaved, and in that case you will see formation of two things. First is the capsid, and second you will see the enzymes like rna polymerase. So RNA polymerase further start replicating the single stranded RNA. First it will convert into the negative polarity, and then it will form the different copies of the positive polarity of the RNA. So here is the basic two things. First is the capsid, and second, from the RNA polymerase it will actually replicate the genome. So two things actually important for the virus: capsid and the protein. Okay, that is actually the overview of the replication of the hepatitis A virus. Next, clinical finding, that's the most important one. So first one is the fever. So in the hepatitis A you will see the fever. Okay, that's the most important thing. Second, you will see the anorexia. The patient will say that he is not in mood of eating or drinking anything, means loss of appetite happens in the hepatitis A virus. Next is the vomiting and the nausea. Vomiting and the nausea will happen in case of hepatitis A virus manifestation. Okay, next is the jaundice. In that case you will see the yellowing of the skin and the eye. That's the most important thing. It means that the bilirubin will start accumulating in our blood. So that's why the patient will look yellowish. That causes jaundice. Next you will see the dark urine. Okay, you will see the dark urine and the pale feces. These are the most important finding: dark urine and the pale feces. Why? Because if you look here, this one, so as we know that from the liver you will see the hepatic duct, and that actually open into the duodenum. Okay, so from the liver bilirubin is not passing into the duodenum. That's the most important thing. Bilirubin from the liver is not going down to the duodenum, and ultimately what will you see in that case? Color of the feces will be pale, and the bilirubin will start accumulating in the blood, and as a result the accumulations of the bilirubin in the blood, that will bilirubin start passing into the urine. So that's why the color of the urine will become dark, and the color of the feces will become pale due to the abnormal distributions of the bilirubin. Okay, these are the important clinical findings: fever, anorexia, vomiting, jaundice, dark urine, and the pale feces. And the recovery, the hepatitis A virus recovers spontaneously within 2 to 4 weeks. And next is the incubation. That's the most important thing. Incubation period is actually the exposure of the hepatitis A virus until the appearance of the symptoms, and that is actually 3 to 4 weeks. Okay, so you will see the appearance of the symptoms will take time, and that time is actually 3 to 4 weeks after the exposure of the virus. Next is the lab diagnosis. So in the lab diagnosis, you will go toward the serology, and you will check for the IgM. In the initial phase, peak phase, you will see the presence of the IgM antibody, and after that you will see the presence of the IgG. That's the most important thing, but the most important criteria is the IgM detection in the blood of the patient. And you can also go towards the LFT, liver function test, in which you will see the different enzyme like ALT, AST, different enzymes, and transaminase, and you can also see the bilirubin in that case. So here are basically the important findings or lab diagnosis in case of hepatitis A virus. So if we look at the treatment and the prevention, so there is no as such treatment for the hepatitis A virus. Yes, the prevention for the hepatitis A virus is obviously present. So important thing, good hygiene is very much important in the prevention of the hepatitis A virus. And you can also go towards the immunization. So basically two types of the immunization: active immunization and the passive immunization. So in the active immunization, you will see the vaccine. Okay, you will see the vaccine for the hepatitis A virus. That's the most important thing. So 2 doses of the vaccine, initial dose, and after 6 to 12 months later, you will get the booster dose against the hepatitis A virus. That's the most important thing. Okay, so hepatitis A vaccine can also be given as a prophylaxis, but keep remember, uh, prophylaxis after the exposure of the virus, and that can be given within 2 weeks after the exposure. That's the most important thing for the active immunization, in which you will inject the dead virus. Okay, and in that case, the most important vaccine is the Twinrix. Twinrix is the vaccine that is used for the hepatitis A and the B virus. Okay, and what type of people actually required the active immunization? People who are actually traveling to the developing countries and between the age 2 to 18 years of age. That's the most important thing. So in passive immunization, that's the most important thing, that can be given prior to the exposure of the hepatitis A virus. Okay, that's the most important thing, in which you will directly inject the antibodies in the passive immunization. So prior to the exposure, or you can say you can give the passive immunization uh, within 14 days after the exposure. That's the most important thing. And you can also give the both active and the passive immunization. In active you will see the vaccine, in passive you see the prepared antibodies. This is all about the hepatitis A virus. If you still have any question, you may ask in the comment section. Thank you so much.